be able to look at, and tell me what's going on here. Locus coeruleus is involved with this. We've touched on locus coeruleus a few times. Yeah?
When we are asked questions about this, like, are we going to have like images to maybe help us?
I would, if I'm going to ask you something, what I would do, and I have the ability to do this, is give you this brain without all of the red stuff on here, okay? And I might say, show me the projection system for this neurotransmitter. Is that reasonable? The answer to that is yes.
Is it that the projection systems are in a particular system?
In the case of noradrenergic projection system, the cell bodies are in the reticular formation.
Oh.
This is the reticular formation right here. This just about defines the reticular formation.
When you say reticular formation, is this coming from the very
No.
top? Or
No, the reticular formation, you remember, is a whole series of structures right here. That's the reticular formation.
This part, or not?
Yeah, it's not the entire rostral part here. That's not there. It's not the inferior part of the caudal part. It's this whole midsection. Okay, this is, really what you should think about is that this is mostly sitting in the posterior pons. I really think that's the way to look at it. Okay?
I thought it was like from rostral unto the...
No, that's the whole reticular formation. This is just looking at the noradrenergic fiber tracts.
Yeah, I mean the whole one.
Yeah, the whole reticular formation is beyond that. Yeah.
Okay, yeah.
And I might have to put a figure in here, I don't remember. Serotonergic. Serotonergic projections, there's a lot more than this. This is the serotonergic projection system in many respects associated with areas adjacent to the reticular formation. In the midbrain, up here, nucleus linearis and two of the raphe nuclei. Then we have the pontine nuclear areas in here, the medullary raphe in here. You should know the nuclear areas in here and what they are essentially projecting to. So these medullary raphe project into the lower medulla down into the spinal cord. The pontine raphe nuclei, or raphe nuclei, project to the cerebellum and project within the pons. The group up here, the dorsal, the medial raphe, the nucleus linearis, project to the thalamus and to the cortex. These are really critical. Remember, with the reticular association with activity and coma and everything, a lot of that is associated in part with these serotonergic pathways. Histaminergic, tuberomammillary nucleus. Yeah, that's another nucleus. All right? You should be able to show that to me. Why? It's part of the mammillary body. The mammillary body is actually a group of nuclei. Projects where? Oh, kind of everywhere. Once again, we have projections to the cerebellum, the midbrain, all of the cortex, the thalamus, heck, which is why when you take an antihistamine, you're drowsy. In many respects, this sits just anterior to the termination of the rostral reticular activating system. So it's kind of interesting. Now, associated with some of this area, we have vascular supply. So you remember, you've learned the circle of Willis. Now you have to really concentrate on the basilar artery and the various vessels coming off of that. We've got the posterior cerebral, we've got the various cerebellar arteries. You should be able to label everything on this in respect to arteries. And then we looked at it from this view, you know, how these are actually now associated with the cerebellum, and how they're associated with the whole base of the brain. This is an important association. When you lose function to any of these, you're going to have very predictable and pretty much traumatic outcomes. Mucking up any of these arteries is going to kind of goof this whole thing up.
When you see like a dark purple, so that whole area will
This-
get, yeah.
this-
yeah,
this
different
area
color,
right here?
Yeah,
Yeah,
so that,
this area right
yeah, the
here.
area will get affected.
Yep.
Okay, so the yellow is,
Each one of these is color coordinated to structures in there.
okay.
So there is a color coordination.
Yeah, because the light purple looks like it's trigeminal Indian, right? On Hans.
Which one?
Let's see the light purple one?
Okay, it doesn't have a name attached.
Yeah, but.
The basilar, the circumferential, these are branches coming off of the basilar artery.
Yeah, but on the structure, if I put like cranial nerve on top of that, like a trigeminal nerve because it's on top of the pond.
Okay.
So whatever.
Would that be affected as well? It would be affected,
function,
all,
whatever.
cranial nerves, okay?
that
You
involves-
have to go to where their nuclei are, and you will get them. If you affect the vascular supply to the entire pons, you will affect a great amount of cranial nerve function. Yes. So if you were to draw in the cranial nerves on here, I could easily ask you, so if we had a problem with, you know, I don't know, with this, the branches coming off of the basilar artery here, which cranial nerves would be affected? You should be able to answer that. I would not expect you to draw them on there. I might give you a figure than
Yeah, so, because it's one on ponds, it's 3 colored, like dark purple.
that. Right, and this depends, but they're each supplied, the vascular supply to each of these areas is slightly different.
Okay. So
Yeah.
when it affects to each artery, then it would affect different structure, different function.
Absolutely.
Okay.
Yeah. We touched on briefly some of the issues with sleep and sleep pathways here in the brain. Please take the time to read the material that goes with that. That's all. I'm not going to have you draw out this pathway. That would be this side of cruel and unusual. So I like the fact that we can still talk to one another. The projection systems and functions become really, really important. This figure with neurotransmitters and function should, for you, tie together a lot of functionality in the cortex based on neurotransmitter. Where are they coming from? Where are they going to? And what's the effect? You know, obviously, you want to see me ask you a question that includes alertness as an option. All right, because look, alertness, 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 alertness. Yay! All right. Well, it's not dopamine. All right. So that's that. You know, you have to just sit down and work on that. This really sums it up nicely, because once again, either in your lives or patient lives, they're going to be, or some family member or friend is going to be getting a drug that affects one of these. And the question is going to be, oh, you know, what's going on? What are they targeting? What's happening? We looked at REM activation and deactivation and what's going on. Please take the time. There's not a lot in the textbook on REM. Take the time to sit down and look at it. Once again, we've gone through so much material. Chances of my being able to ask you 2 questions on something is minimal. So, and once again, I would not have you label something like this. I want you to understand the REM. Big transition, attention, alertness, awareness. I want you to understand those 3 concepts. Those concepts are important because those concepts are used to assess a level of brain damage, brain issue, normal brain function. So please, do that. Look at it. All right? Yeah, brain dead. Yeah, it's kind of extreme. Going all the way back, looking at brain dead, at coma, vegetative state, minimally conscious, akinetic mutism, etc., locked in. We talked about all of those, tried to summarize things a little bit for you here, and really you have to review that. Those are very important functions and concepts. We transition from there to the cerebellum. Yay, cerebellum. Okay? It's not hard to label. There aren't a lot of crazy structures. It's kind of pretty when you actually look at it. Oh yeah, I've used this slide several times. All right? But now as we look at the cerebellum, we've got these major and vast blood supply functional areas. The cerebellum basically gets the majority of its blood supply from 3 major arterial branches along the inferior aspect of the basilar artery and the superior aspect of the basilar artery. You should be able to follow those out. This is, once again, this is one of those figures, you go, yeah, Kel, put that one on the exam. Yay, I can do that. Okay? It's pretty straightforward. Being able to describe what some of these functional areas does, that's a little more complicated. You should be able to do that. You should be able to understand what's going on with the cerebellum. You should be able to understand the peduncles. Okay? So we have the brain stem, we've cut the cerebellum off. Here are the peduncles. Here are some more peduncles. But now things got weird. Okay? I look at this and I go, this is so cool. You look at this and say, oh my God, what's going to happen here? And I kept saying, oh, most of what comes out of the cerebellum is inhibitory. And you look at this and say, most of what I see here is excitatory. Until you start to take a look at the picture, start to realize what is going on here, what's happening. How do these signals get in? They're all excitatory coming in, and how do they get out? Many levels of inhibition. So there's all sorts of inhibitional? I guess that's right. Signaling going on, where you can inhibit a little bit of a signal, a lot of a signal, or all of the signal. So please, I'm going to ask you questions on that. As a matter of fact, I'll tell you right now, I'm gonna ask you questions involving